We put in the spotlight is stress. I'm going to pick up on Cindy Crawford and stress in just a couple of moments. There's stress relief right there for most people. But before we get to Cindy Crawford, supermodel extraordinaire, Saru on the line. Morning.
Morning, Aiden.
Yeah, how's it going, mate?
I'm alright, yourself.
No worries. I believe you might have some stress.
I don't know. That's why I'm asking the question. I've been suffering constantly from heartburn and acid reflux, gas reflux, as you can call it. And I also get these numbness sometimes in my hands or in my neck, spasms like that. So I don't know if it's the cause of the stress, because I heard what the doctor was saying about stress now.
And that's the danger. You hear someone on the radio and it's like, I've got all those symptoms. That could be me.
Yes.
Yeah, so this is why you're phoning. So, and obviously, Doc, you can't examine him, so it makes it really difficult. But generally, listening to somebody presenting with those kinds of symptoms, what would you flag with him?
He sounds like a young, funky man. I mean, he sounds like a guy that's
like
normally got it together, just like us. And obviously, something's been disturbed there. His matrix, his equilibrium has been disturbed. So he's certainly got symptoms of excessive acid production. I mean, when you have a lot of flatulence or gas, often it's a result of things like excessive acid production in the tummy, obviously what you're doing with your diet around your stress, etc. But, he also mentions neck spasms. We all know that towards the afternoons in most of our days, that's when a lot of neck spasm gets worse. And then you get what's called tension-type headaches as the afternoon comes on.
Yeah.
And that can certainly limit your productivity, limit your performance. And certainly there's a few things. He mentions pins and needles, which are the right words, paresthesia. The question is it in both hands or both arms, or is it in one arm? Because often that can result from the neck pain or spasm or, nerve pain radiating from the neck down the arm. But also that hyperventilation I spoke about, where subconsciously you just end up breathing a bit faster.
Soek asem.
Yes, soek asem. You're breathing faster, blowing off too much carbon dioxide can also lead to pins and needles in the hands or fingertips, and that's one of the symptoms that you need to look out for chronic anxiety, a bit of panic attacks as well. That's also how people present.
Yeah. So Ruben, the sounds of it, you have the typical symptoms. It's worth checking out with a physician. It's worth heading to your practitioner and getting him or her to give you a once over.
You know what? The funny thing about it, I've been to a couple of doctors and I've spoken to him, and everybody's just giving me the same thing. So that's why I'm so confused. I don't know what is actually happening.
So what are they saying to you?
What are they saying?
Everybody's telling me I need to use this tablet for the stress, for the gas, eat properly, and which I'm trying to do that. But I'm starting to get it now. Lately I've been getting where I wake up in the morning, I have pins and needles in my hands, like the doctor just said now.
Yes, so then I think you should also have a look at your neck and then the muscle spasms and things like that. One would certainly want to look firstly with a basic x-ray at the structure of your neck vertebra and see if there isn't a malalignment problem in the mechanics of your neck. And often, depending on your work and what you're doing daily, whether you're sitting in front of a computer, for example, in a funny position, raising your arm, typing, so on, while you're driving, if you drive long periods of time, one would look at all those things and look at activity that's related to your muscles going into spasm in your neck that could be causing pins and needles in your arm.
I think also maybe to be my workers, because I do engineering work with a lot of heavy weights and turning and tightening of things, so
yes,
maybe that could also be a problem.
No, certainly. I think you just need to have a systematic approach and a very good practitioner to work through things with you systematically, and as you exclude them, you should actually feel very good. There's no heart problem, check your ECGs out.
Yeah.
There's no heart problem. Have a look at your tummy and your digestive system. When that's sorted out, you move on. So certainly something that you need to give attention to, definitely.
All right. Thanks, Dave, for the call. That's